Hi, good morning. Today I'm going to be interviewing Dr. Victor Longo. Dr. Longo, I'm going to read some of his CV. He's a biochemist. He did his PhD in biochemistry in the field of calorie restriction, and he has a postdoctoral degree in neurobiology. He's also well-versed and trained in immunology, gerontology, molecular biology, and pathology. Currently, he is the dual director of the Edna Jones Gerontology and Biologic Science Center, and also the Longevity Institute at the University of Southern California. His research has been centered primarily on age and age-related disease, but it is now branched into age-related disease associated with cancer. It's important that this connection be made, that aging is often the priority in terms of risk factor for cancer. Currently, he has developed at his lab a 5-day periodic dietary intervention called Fasting Mimicking Disease that decreases markers and also decreases the risk of premature aging. He also handles and authored multiple papers on fasting-related disease in the realm of cancer. Most of it has been in the research with mice, but a lot of his current research is being done at universities and clinical studies on patients, which he has no connection to. He is only providing the information that he understands to be important in using a fasting mimicking diet related to supportive care of cancer. He has also created a foundation called Creates Cures and also has written books on longevity and cancer fasting, and also was the co-founder of a company that produces products related to fasting mimicking disease. An amazing aspect in this day and age is he donates all the profits from all of these back to the foundation and takes no money for himself. So I'm very excited to be able to interview him and provide for you information on what you can do in the realm of diet and perhaps even fasting mimicking diet that will help you in your journey associated with cancer. Thank you. Good morning.
Hello.
Good morning.
How are you?
I'm great. Thank you very much for your time this morning.
Oh, you're welcome. Thank you for having me.
You're certainly, I'm just so enthralled with with your books and your articles, and the more I delve into it, it's very exciting to see. I think that, in kind of beginning our thoughts here, as a practitioner, most of the information that I've used to help ill patients, cancer patients, has been revolved around giving people things to eat and things to take. It's kind of like if you get the right diet, if you get these right supplements, we can, especially in cancer, you can change the signaling, you'll do much better. And yet you are at the other end going, well, wait a second, maybe there's something we should be doing about not eating that will be very beneficial to people. And I'm not sure people in a situation of dealing with their cancer know a great deal about the data and the work and the experience that's going on now with your work in fasting. And that's, I guess, the primary goal of talking today, is to hear more about how you've gotten into this and how exciting it is for you to probably be seeing such amazing information and data coming out.
Yeah. I think historically, nutrition was just viewed as that, something that you do, and the oncologists basically say, okay, eat whatever you want, but obviously underestimating the fact that cancer cells have to eat, and normal cells have to eat, and immune cells have to eat, and so you see the key components of whether somebody lives or dies are all based on nutrients and the lack of nutrients, and so. Yeah, so I think it's underestimated in general, the power of some of these interventions. Has little to do with nutrition and a lot to do with regulating in a differential way lots of genes in cancer cells and normal cells to allow whatever therapy to work better or a lot better. I mean, that's really what it's about, right? It's just splitting cancer cells and normal cells, and then thinking about, well, what is it? Is it immunotherapy, chemotherapy, radiotherapy, hormone therapy, and bringing not just splitting them, but also bringing in the molecular understanding, the mechanisms, like, well, what happens exactly? Why is immunotherapy working? And how do we expose a cancer cells more to the immune system? How do we make the immune system stronger? I mean, so there's a lot of things that are considered in what we do, and I think what it should be a field, an important field, not just of nutrition, but using food as medicine, essentially.
That's a different, obviously, philosophy that if physicians were to embrace that more, it only would help the patients more to be using whatever tools are available.
I mean, it will revolutionize everything, right? Because so now, just looking at diabetes, we now have 5 clinical trials where we can regress diabetes, right? And there is a paper just this morning in the Guardian, basically saying, the people on GLP-1 receptor agonist, most of them will go back to their, as soon as they stop, they will go back within 20 months to their original weight. I mean, so not only the great majority of them stop the drugs, but when they stop, so I think one report showed 85% blocking the drugs, discontinuing drug use, GLP-1 receptor agonist use. And now this report is not the first one, but it's clearly yet another report showing that within 12 to 20 months they return to their original weight. So I mean, this is, I use this as an example because it's the number one drug or category of drug in the world right now, and probably in history, right? And so now we have 5 trials where we show the fasting mimicking diet cycles can regress diabetes, and then clearly we have some of them are long-term, 12 months. No side effects. Really an anti-aging intervention that is affecting your cellular function, your overall biological age, and it's reducing fat with minimal effects on lean mass. And yet nobody knows about this, right? everybody knows about the GLP-1, the semaglutide, right? So this is the world we live in, and not surprisingly, we had the political change recently that we've had, and a lot of people are upset and are upset about, this doesn't sound right? You spend so much money on healthcare, and what do I get? Maybe position between 50th and 70th in the world for healthcare quality, right? Not a good deal, right? If it was anything else, people would be on the street saying, hey, wait a minute, why am I paying more than anybody else in the world? And I get a terrible service, but people are just got used to it for some reason.
Yes, they adapt. Well, it's interesting that it sounds like your original direction was in the longevity field, more how do we help people live a quality life that's longer? And maybe you could talk about how you saw and made that transition from dealing with just a better quality and longer life to helping people that were sick.
Yeah. Well, I mean, it all started very near you, right? In near Tucson, in Arizona, with Roy Walford. And Roy was a MD from UCLA, and he came to Arizona and he started like Biosphere 2 project, right? And
Right.
and yeah, so the Biosphere 2 project. So when I joined his lab, he actually was right there near you, in this Biosphere 2, and he was doing the first human calorie restriction study. And I always say that was very impressive study that the world medically generally ignored. But in that study, he has shown that with 8 people that were locked in this Biosphere 2, which was an enclosed environment
Yes.
in desert near you, but they showed that if you look at fasting glucose, cholesterol, blood pressure, lots of markers that most doctors in the world will recognize as key, they were the lowest level that you can imagine, right? So that was a great lesson for me because on one side, I saw how powerful calorie restriction was. On the other side, I saw how detrimental calorie restriction was, right? So they were pushed over the limit. They were very, very skinny. They were stressed out. And yeah, so that was the sort of the motivation to, can we come up with something that achieves all these incredible effects, but without the burden and without the side effects, right? So that's where my work, on the fasting mimicking diets. And so the idea was like, whether it's cancer or diabetes or just general health, can we act, once every so long, like a month, every 2 months, every 3 months, for 5 days or 4 days or 7 days, and then can this last a long time? And that's what we've been focusing on for 20 years now.
Well, and besides focusing on it, you've actually created both a company and a foundation that support that and help people understand it. I think it's, people talk about calorie restriction and talk about how to do this, but you actually developed foods that people can use that actually allow them to continue receiving nutrition, but at the same time get the benefits of what the fasting mimicking diet will do.
I used to look at it from that point of view of allowing people to eat and get the benefits of fasting. And then I met someone at the FDA, one of the directors there, and he said something very interesting, which was we were discussing the potential of FMD, the fasting mimicking diet, becoming an FDA approved medicine. And I said, I know why the FMD works. And he said, no, you don't, right? And his point was, you don't know. Once you have a composition, once you have food as medicine, you have to be respectful of the standard that the FDA has put together, because it could be there's 2 ingredients in there that are necessary for the effects you're seeing. Yes, you can get lots of things with water only, fasting, but that doesn't mean what you're seeing here for a particular population is caused by that water only effect, right? Yes, unless you compared it, you don't know. And so the only time we did it was in mice, right? And was from an inflammatory bowel disease model in mice where they're getting like Crohn's and colitis. And sure enough, the only time we compared water-only fasting and FMD, the FMD was more effective than water-only fasting. The water-only fasting caused leakiness of the gut. The FMD didn't, and the FMD was superior in solving problems. And then it turned out that probably had to do with the prebiotic ingredients of the fasting mimicking diet feeding the lactobacillus and bifidobacteria population in the gut of the mice. So then I think I moved away from the idea of replacing fasting and into the idea, all right, okay, this is a fasting mimicking diet. There's various types, and their medicine, it's a vegan-based medicine, is a plant-based medicine, and it's been tested for certain uses, right? And that's it, right? And so, yeah, and I think it's very important to do that, because otherwise the physicians all over the world, you will always look at it skeptically, right? And this allows, independent hospitals and clinical centers to test it, right? They get a box, they give it to the patient. Does it work? Yes or no? And independently of the company or me, and they just get to make a decision, right? So yeah, so I think it's very important that we standardize it, but we now have an alternative to, let's say, GLP-1 receptor agonist or lots of other drugs. Or in the case of cancer, we have something that, hey, the oncologist can say, I tested it together with chemo or immunotherapy, and it worked better or not, right? And so yeah, I think that's the best way to look at it. It's a medicine, but it's a medicine that needs to be tested before it's proven to be effective.
And are you getting support from the oncology community in doing this now?
I mean, there's a lot of trials, right? I think over 20 trials that have been done, clinical trials that have been done with fasting mimicking diets. So I think there is a lot of interest, and now you're starting to see data indicating increased overall survival, at least in metastatic triple negative breast cancer, and increase complete pathological response. So yeah, I think that there's certainly a lot of interest in the oncology community, but it's a lot of cancers and even more therapy. So I think that it's going to take longer to test it in each different with each different therapy for each different cancer.
Well, but I would suspect that if, I don't know whether an oncologist would agree, but in primary care, if someone came to me and said, I'm on chemotherapy, do you think there's anything wrong with me trying this fasting mimicking diet? I would have to say, let's see if it helps you or not. I mean, it's really experiential. And patients are demanding a lot more going through their cancers and wanting to do things that will help them. And this seems like a pretty much non-toxic, beneficial way of approaching it. And I think that's how, is that what you're seeing, is that patients are starting to want to use this as a form of addition or support to their cancer?
Well, I mean, yeah, lots of patients, of course, are looking for enhancing, reducing side effects and enhancing the efficacy of therapy. I would say that, for the cancers where you expect a very high overall survival, let's say a stage 1 where you're going to receive surgery, probably until we have more data, I would say I wouldn't, interfere with a 98% chance of cure, because we don't know. I mean, fasting mimicking diets are very powerful, and so they could protect you, but, hey, there could also be the opposite, right? Until you test it, we don't know. I mean, certainly in mice, it's very powerful, right? It's very powerful against many, many different type of cancer in combination with lots of drugs. But that's mice, right? And so I would say, now, if a stage 1 patient is undergoing terrible side effects, right? And or things are clearly not working, and yeah, so I think that then the oncologist should say, whatever we're doing, it's not working very well, and yeah, then they together with the oncologist, the fasting mimicking diet that has been tested now formally on at least over 1,000 cancer patients in clinical trials, yeah, that they could say it's safe. So you're having these severe side effects. Let's try. Let's see if this helps you reduce the side effects. And yeah, so I think that that's a good way to look at it. Now, if you're triple negative breast cancer, I mean metastatic breast cancer patient, or if you're an advanced stage metastatic breast cancer of any kind, then I would say I would strongly encourage you to talk to your oncologist about the fasting mimicking diet, especially if the oncologist is saying we really don't have anything that has been shown to be effective against this metastatic cancer, or we tried that and it didn't work. Okay, so that's when I would definitely talk to the oncologist about adding the FMD to the standard of care.
Would you mind discussing a little bit? I know that there is this whole concept with doing fasting mimicking diets that you're protecting normal cells and you're affecting cancer cells in an adverse way. Could you, I don't know whether the people that are going to be watching this are going to necessarily understand the difference between how it works. I wonder if you could talk a little about that.
Yeah, so essentially, if you look at all organisms, right, even bacteria, they respond to fasting by reducing or stopping growth, and they usually become protected, right? There's an old mechanism that makes fasting cells more protected against lots of things that you can expose them to, let's say radiations or let's say chemicals, toxic chemicals. So yeah, then if you look at a human body or a mouse, it will, if it's being fasted, it will in a coordinated way try to stop as much as possible growth, cellular growth, and become somewhat protected. The cancer cells instead don't, by definition, don't respond to that order, right? They fasting is happening, the signals are being given, but the cancer cells refuse to respond, right? And that's one of the hallmarks of cancer. Refusal to respond to anti-growth signal. And so yeah, so that if you think about it, it's a really powerful way to distinguish all cancer cells, because it's a definition of cancer. It's not a definition of some cancers. All cancers, this is a hallmark for all cancer cells. And so, yeah, so now it's a way to distinguish all cancer cells from all normal cells, right? So you send them in separate direction. And so now you can see how once you separate them, and I always give an analogy of so imagine you put a million people in the desert, and in one case they can sit down, be in the shade and drink, right? And in another case, they have no water, they're exposed to the sun, and they're running, right? And so cancer cells are always running, right? They can't stop running. And so now you sort of have to exploit that knowledge that they cannot stop running, right? So if I put them in the desert, so now I take away the water, that's a fasting, and then I expose them to the sun, that's a chemo, radiation, immunotherapy. Who's going to survive if you put a million people in that condition? Nobody's going to survive, right? Not a single person is going to survive. Now, if you look at the other group that is in the shade with the water, yeah, most of them will survive. Most of them will survive, and the great majority. Now, if you take away one or the other, still a lot of people are going to survive, right? Even if they're running, and if they're in the sun, but you give them a lot of water, a couple of weeks later, a lot of them will survive, right? So you need to take all of it away, right? Or you need to apply all of it. They got to be running under the sun with no water, right? And then you get them all, right? So that's where the synergism comes, right? This is why I always say we've never seen a mouse cured with fasting, right? But we also never seen a mouse cured with immunotherapy, with chemotherapy, with radiation. Never, right? I mean, never a single mouse. I mean, a single. I shouldn't say that. We've seen it a few times, but as a group, we've never seen it. And yeah, so that. But then, if you already combine chemo with fasting mimicking diet, you start seeing cancer-free mice, right? Just the two things, right? You start seeing cancer-free mice. In some cases, 40, 60% cancer-free. So yeah, so the combination, like it would be the sun and the lack of water, the combination is powerful for a person, a cell that is running all the time. Yeah.
Well, and you're saying that you have to discriminate about where you do this because you're going to have more effect in a situation that isn't working well rather than someone that has a good chance of doing well without anything more.
Yeah, I think if somebody is got a very high chance, let's say 98% of doing very well with the standard of care, you just don't want to touch that, right? It's such already high number that interfering with that, that you have a higher chance of something going wrong than something making it even better, right? So unless again, if you're now having very bad side effects, that's a different story, right? That's when, yeah, the patient will want to talk to the oncologist and say, okay, well, can I try this and see how I feel?
Well, I think it's also interesting just thinking about what to do for someone that's healthy, the concept of allowing your cells to repair and rest and be protected offers another aspect for people that are as a preventive thing. Also, it's not just for treatment, but you're describing things that might really benefit someone that's in good health but needs some way of trying to prevent things from taking the wrong turn.
Yeah, absolutely. So now I think there's 45 clinical trials that have been done or are ongoing with the fasting mimicking diet, and so now we're starting to see the fundamental properties of this FMD, right? This plan. I mean, and my original idea was let's have the fasting mimicking diet. So let's have components that trigger fasting responses in the human body. But let's do it with a very healthy, the healthiest composition of food that I can think of based on the longevity zones of the world. Okinawa, Southern Italy, Loma Linda. So I use only the ingredients that were always associated in longevity, but also like the type of ingredients used in the New England Journal of Medicine coming up over and over and over as protective, like say, walnuts and almonds and olive oil, right? So yeah, so that was a good idea because now I think this combination is very powerful because it does lots of things to people. Well, one of them is it makes them vegan for 5 days, right? Which is alone, I think it's already, I mean, I never thought about that, but just the fact that, you now, for example, now we're thinking of doing it in southern Italy. Now we're thinking it, but we're building a clinical trial in southern Italy in one of the worst areas for obesity in Europe, near Naples. And the idea is to do it in 14 to 18-year-olds that are overweight and obese, right? And so the idea is it possible if you take a teenager that is 14 years old and has been overweight or obese, that those 5 days of a vegan diet are training the brain to move away from addictive foods, high sugar, high fat, fried, et cetera, et cetera. So that's already something that's very important. And then, of course, now in mice and rats, we're showing activation of Yamanaka factors. So these reprogramming factors in cells of the kidney, of the pancreas, of the gut, of the brain. So either stem cells or reprogramming factors are turned on in multiple organs. And so the organs essentially shrink a little bit, and then they re-expand. And this process of shrinking and re-expansion, and this includes the immune system, so the blood, right? So a lot of cells of the blood will shrink, meaning that there is less white blood cells, for example, or they get redistributed, or so they might go to the bone marrow. And so shrinking and re-expansion. And this process of shrinking and re-expansion, on one side, you have something called autophagy, so the clearance of a lot of accumulated damage components, but then stem cell and reprogramming. So autophagy, stem cell, and reprogramming, I think together that we now have 2 trials indicating that people become younger and healthier or much healthier. Yeah, so.
That's exciting to hear.
Yeah, so about 2.5 years, right? So they don't become 22, but yeah, the 2.5 years biological age reduction, and so now we're testing this in southern Italy with 500 people. Actually, we're almost done with that trial, and we only testing it once every 3 months. So what happens if you do it only once every 3 months? We'll see the results, but the preliminary data looks pretty promising.
That's pretty amazing. Well, I think there's, and also besides perhaps extending longevity, you'd have to suspect that if you're able to enhance the functioning of your cells, just your whole vitality of your whole body has to change. People, besides not eating the foods, you would suspect that when they do this fast, they recognize that they feel differently, which has got to be a great reinforcement for people to want to do this.
Yeah, they feel differently. They're also reducing medication, right? So all the trials thus far, so in the diabetes trials, you see about 60 to 70% of patients reducing medication, right? So they get an A1C reduction in spite of reducing medication. But even as important is that they reduce hypertension medication too, right? So now in the same trial, you see 60, 70% of the diabetes medication being reduced, A1C being reduced, and then a lot of those that have hypertension or on hypertension drugs, they reduce them, right? So this is suggesting multi-systemic effects. And yeah, and also I think now we're starting to see in a world of drugs and GLP-1 receptor agonists that are making a lot of people miserable. We're seeing the opposite. We're seeing what I think is one of the most important things. People always say, well, it's difficult, right? The 5 days, even every 3 months, is going to be difficult for people. And I said, look at the 50s and the 60s, right? In the 50s, nobody exercised. right? Nobody exercised. I mean, I was reading an interview on CNN by the doctor that came up with the first book on exercise, right? This was in the 60s. And he said, doctors were calling him saying, what are you doing? Why are you telling people to exercise? This is going to kill people. So it's remarkable, right? Because to us, it's just ridiculous. Most young people right now wouldn't even know that there was a time when nobody exercised. It wasn't that long ago. And now I think the data suggests that about half of Europeans and half of Americans, adults, will do 150 minutes a week of exercise, right? So it's a lot, right? So people are willing to do much more than we give them credit for, right? They just need to know, like in the case of exercise, there's no doubt this is good for me, right? Yeah, so I think that's where the fasting mimicking diet comes in. Is soon enough, I hope that doctors will say there is no doubt. Now that it's going to be, pretty soon there's going to be 100 clinical trials, right? So I hope physicians all over the world say there is no doubt doing it 2 or 3 times a year is good for you, right? It's just 10 to 15 days a year dedicated to this, whether you're a teenager or an adult. So do it, right? And yeah, so that's my hope. But we'll see what happens.
Well, and rejuvenating an older body and reprogramming it and giving it more abilities has to be beneficial and protective.
Well, I mean, it is beneficial and protective, right? So this is now clinically shown in many trials. And by the way, these trials, I mean, people sometimes, I get criticized because they say, well, conflict of interest, and he's running the trial. I don't run any of the trials, right? And El Nutra doesn't run any of the trials. The great majority of the trials that were done in the FMD were done completely independently by universities with their own funds, right? So if they had gotten bad results, they will have, let's say, diabetes, University of Heidelberg, their own funds, University of Leiden, their own funds, University of Rome, Tor Vergata, their own funds. So no influence from the company, no money from the company. So this is very important, right? Because these data is now indicating younger biological age and whether it's kidney damage or I mean the kidney is still preliminary data, but certainly the early data suggesting improvements also in kidney function and or diabetes or prediabetes. And now this year we're going to see multiple papers on autoimmunities. I cannot talk about it, but we're going to see multiple papers from big universities on autoimmunities. So yeah, so I think that it's no longer, at least for prediabetes, diabetes, and obesity and overweight, it's no longer a possibility. It's very clear from many clinical trials. Cancer, still early, so we'll see, and then the other diseases, of course, still very early.
So you're saying that there will be papers that might reflect some effect on autoimmune problems.
Yeah, there's going to be 3 papers this year on autoimmunities. Yeah.
That's terrific. So you made reference to a company that does some of the products, but I was very impressed in looking at your book that even though you were the founder of the company, you don't even take any money out of the company for yourself.
Yeah, big mistake, right? So yeah, no, I don't, right? I don't, and so the all the money that will go to me, then instead goes to the foundation. So in the foundations, it does a lot of good things for cancer patients and activities in schools and education and yeah. So we're trying to generate a movement so that people sees food and fasting and fasting mimicking diet as medicine, and so give at least a portion of the population that is willing to listen an opportunity to be much healthier and a normal weight and long lived. Yeah.
Could you talk a little bit about your foundation called Creates Cures? I was fascinated to look at the website and see the availability of help that's there.
Yeah, so Create Cures now between the Italian one, Italy actually has 4 or 5 centers. It's a little bit ahead of the American one. The American foundation is here in Los Angeles. And but yeah, sees thousands of patients every year. We have many nutrition experts, a number of them with PhDs, and so a lot of registered dietitians and physicians, and of course a lot of collaborations with physicians and major universities and also private physicians. Yeah, so the idea is to bring in not just a nutrition expert, but an integrated team that's, so let's say the person has cancer, of course, they keep their own oncologist. And we make it clear to the patient, your oncologist is going to make the decision together with you on what you do. We're just here to give recommendation to both of you, the oncologist and you as a patient, what we think will work best. And that team usually involves a molecular biologist. So the molecular biologist, usually with oncology research expertise, has the job of looking at the particular cancer and how we strategize to make whatever it is that is being given to the patient work better, right? But we're doing something that you figure everybody should be doing, but doesn't happen, right? So we're looking at the muscle mass, the strength, the exercise. Are this person the psychological issues? So the 360 type of integrative support that is going to help, and we know that from lots of data now, that is going to get the patient, keep fighting and keep doing everything, but also it's going to help, hopefully, making more cancer cells die and more normal cells thrive, right? So I think it's a combination of keeping the strength and killing more cancer cells and killing less normal cells and doing less damage to the normal cells.
Well, it's interesting because with you saying that just using chemotherapy, using oncologic therapies, the cancer isn't necessarily gone. It's not. So this sounds like it's also something that when patients are finished with their treatment, if their body is not too malnourished, using something like Creates Cures is a way for them to also do the fasting mimicking diet to help rejuvenate and recover from this.
Well, we go much further than that, right? So for example, I give you an example. We follow lots of prostate cancer patients, right? And so now, so we do a lot of research on prostate cancer in the lab and on breast cancer. Yeah, so we have direct knowledge of what nutritional interventions, and that's both everyday nutrition, time restricted eating, and fasting mimicking diet and ketogenic diet. So we look at it, all the type of different ways where we can make things difficult for the cancer cell. So let's say in some prostate cancer patients, we'll say, so we know that, for example, hormone therapy can synergize with fasting mimicking diets in knocking down or blocking the growth or killing prostate cancer cells, like it is in breast cancer cells, hormone ER positive breast cancer cells. Yeah, so then we would time the fasting mimicking diet with the hormone therapy to make sure that we kill as many prostate cancer or breast cancer cells as possible. And now, yeah, so then of course that's with the approval of the oncologist. But and then on top of that, we're looking at, let's say, muscle mass and fat mass and inflammation and lots of different things. So we want to try to kill as many cancer cells, but at the same time, if the patient has lost a lot of muscle mass, we need to bring that patient back up as much as possible. And so we have, let's say, muscle training and exercise. And so it's just a 360 degree view of, can we bring the patient back to full health? And can we, again, kill as many cells as possible? And sometimes we even tell patient or oncologist, hey, what about this? Why not go back to this, right? And, so of course, we don't make the decision. The oncologist does. But we can give the recommendation, say, hey, we think maybe the hormone therapy didn't work before, but now we added the fasting mimicking diet. would you be willing to try again hormone therapy and see if this time in the combination it works, right? So yeah, so that's the type of reasoning that we have at the foundation.
So you have people come directly to your clinic in LA to be evaluated and seen, or do people do things virtually or both?
Both, yeah. So a lot of patients are all over the United States and the world, so that we can do it with Zoom. But yeah, but if they're in the area or they want to come one time, but probably no more than once a year, so most of the things can be done from the distance. Yeah.
Well, it just sounds like such a great opportunity for people to get so much information about what they can be doing proactively. And there's actually research in what you're doing to support this. So I think it's just a great win for people that they're willing to, like you said, if they're willing to put in certain number of days a year, they can really do very well in that
Yeah,
regard.
I think it's I mean our job, of course, the job of everybody at the foundation is to get people to 110 healthy, right? That's a job, right? And so whether they have cancer or diabetes or we're always thinking about how do we get you out of this, and then how do we get you out hopefully so you can live a long time healthy. Of course, it doesn't always work, and understandably so, for patients, especially their stage 4 metastatic. But we've also in my book, the Fasting Cancer, which I just published recently, and by the way, 100% of the royalties go to the foundation, not to me, so I don't make a penny out of the books either.
So
But
that might be this one right here.
yeah, Fasting Cancer, yeah. Yeah, and so we show that a number, and not just us now, there are publications from oncology saying, hey, we were surprised that, stage 4 colorectal cancer, stage 4 lung cancer, stage 4 breast cancer, stage 4 even pancreatic cancer, they go into remission, right? Which is very unusual. It doesn't mean that there's no miracle. It doesn't mean that everybody's going to the remission if they're stage 4, but just it happens. And it happens more often than these oncologists were expecting, and in people that were using the fasting, in patients that were using the fasting mimicking diet. So I think that's also a very, very important part. Like no matter we have glioblastoma, stage 4 metastasis everywhere patients, and we tell them, yeah, you don't know, right? Yes, it's really tough, but there is a possibility that you're going to live many more years, and there is a possibility, who knows, right? That maybe somebody will come up with a cure in 3 years, and all you have to do is make it to that point where there is a cure, right? So yeah, so I think that's very important in the treatment of patients, to also know that yes, it's really tough, but hey, we've seen lots of remissions out of stage 4, and even in the impossible cancers, everything is possible.
Well, maintaining an attitude of possibility that things will get better, for a person has to be just a wonderful opportunity, especially for families, that there's something that they can do that might really help things. I think that's great. So
Yeah.
can you talk a little about where you see the next several years going in terms of, it sounds like you have a lot of research and you're hoping to get many more universities and many more studies out there to really show what you can do, because from what you said at the beginning, it could be revolutionary.
Yeah, I mean, I thought that the revolution should come, I think, from a method, right? Not necessarily just from the FMD, but I think the FMD can certainly help the revolution, right? So, also because the great majority of people are now willing to change lifestyle. I always say, it's difficult if somebody drinks 3 coffees a day. It's difficult to say, can you do 2 from now on, right? Most people say, I don't know, I'm not sure that I can go from 3 to 2, right? So unfortunately, that's how people are, and so we have to think differently. We cannot say, oh, either you revolutionize your diet and you eat 30% less than before, or you have drugs. We need to also say, okay, yeah, maybe you can change part of your diet. This is what we do in the foundation clinic, right? what can you change? Well, I'm willing to make these changes. Okay, fine. And then we give the FMD. And then if all of it fails, then yeah, of course, drugs. So some people, or bariatric surgery to some people, that's all you got, right? That's all it's going to work. So, but that should be the very last resort, right? So the revolution, I think, needs to look at how do we get everybody to 110 healthy, starting from weight, right? Of course, and obesity and insulin resistance and lots of things that, hey, a lot of people have now, and we're kind of getting used to it, right? So having 75% overweight and obesity in the US and 60% in Europe should not be viewed as normal, right? It should be viewed as we were not like this 100 years ago. Nobody in the United States was obese. So why are all of a sudden 75% and rate of overweight and obesity, and that's normal? And that's not normal. And why is nobody fighting this, right? Why isn't this being treated like COVID was treated? That's really strange. It makes you think there's a lot of interest from big food, big pharma, big health, right? So yeah, I mean, and there is nothing wrong with big food, big pharma, big health. I mean, most things are okay for you, right? I mean, I even say, there's nothing wrong with some candy or sugary drink once in a while, right? But it has to be regulated, right? So we cannot have people or children eating a lot of super over processed or ultra processed food and a lot of sugary drinks, and so yeah, so that's certainly we need a revolution that brings people back to that. And it doesn't criticize effort, right? It doesn't criticize, oh, it's difficult for you. It should be difficult for you, not very difficult. I always say, I think if we told people you have to exercise you have to run 50 miles a week, right? Most people say that's crazy. I'm not going to do that, right? But if you say, okay, you have to run 10 miles a week, okay, or 5 miles, I think a lot of people can say, you know what, not easy, but probably a good idea. And that's what people do, right? 50% of people do that. So yeah, so I think that that's the same with food. We need to come up with things that are reasonable, and that I think will constitute a revolution, because it will slowly bring people. And there's, we see this all the time in the foundation clinics, right? It just takes us a couple of years to bring somebody diabetic and full of drugs to normal, but now we make them normal, and they don't feel like, oh, they were asked to run 50 miles a week, and they're going to say, come on, I did it for these 2 years, but I can't do this anymore, right? They feel like, okay, now, hey, I feel good, and I'm eating this way. It's not that different from what I used to eat, but now there's few things that have changed, and to me, those changes allow me, without being hungry all the time, allow me to keep a good weight and be healthy.
That's a great thought. It's just, it's inspirational to think that that potential is out there. So I'm going to let you go and say thank you very much for your time. And I'm hoping that people can look for your fasting cancer book and look at Creates Cures. I think those are things that people just need to, like you said, you can't force people to do it, but if people have, some sort of consideration of maybe this is for me, it's worthwhile for them to look at it. And I can't thank you enough for taking this amount of time from your busy day, and I appreciate it.
Oh, you're very welcome. Thank you.
Thank you.